Hello, I'm Salomine Theron. I'm one of the radiologists at SCP Radiology.
Hi, my name is Charnel. I work at SCP and my speciality is CT.
So very often when head trauma is suspected, so that would include motor vehicle accidents, bicycle accidents, or a fall from a height. So usually after the child has been assessed in the ER situation, the clinician will be worried when the child is drowsy or has had an episode of vomiting, or when they have any neurological signs. And that could include things like weakness in the arm, weakness in the leg, drooping of the face, or any symptoms like that would be really worrying, and they would want to exclude intracranial injury, so a brain bleed. When a radiologist looks at a CT brain of a child who has had head trauma, we definitely want to exclude any injury to the brain. So this can include just brain edema, so generalized swelling of the entire brain, but it can also be a hemorrhage within the brain parenchyma. We also want to make sure that there's no hemorrhage on the surface of the brain, since this can cause a lot of pressure on the brain and can have severe consequences. Another thing that we want to exclude is a fracture of the skull or fractures of the facial bones. So it is extremely important to timeously diagnose hemorrhages within the brain, on the surface of the brain, or skull fractures that might need surgical intervention. You want the surgical intervention to be as soon as possible after the traumatic injury. So in that case, it's extremely important to have a CT scan and be able to make that diagnosis.
When scanning pediatrics children, obviously depending on age, the younger they are, the more difficult it will be to get cooperation. So that obviously makes it much more challenging. Going to the doctor, everyone looking at you, strangers, this big machine. So it's overall just challenging to have to deal with pediatrics because it is so scary for them. So we try to make it as unscary as possible. We prefer for the parents to stand in the room if the mothers aren't pregnant. We also provide them with lead protection so that they can stand in the room with the child. The best thing that a parent can do to explain to their child beforehand is to explain that it is just a photo, and just like a normal photo, you just lie nice and still. We don't want any movement. So when a child comes for a CT brain, we will lie them down on the bed. We cover them with lead shielding over their gonads so that protect them from the radiation. They just lie on a special cushion to secure their head, and then the bed will move through. It's a donut circular shape. So they'll lie on the bed, it'll move through there. It moves through there twice. We do a planning scan first to make sure that we cover the brain so that we're not just shooting in the dark. And then we'll do the full scan where they scan the entire brain.
In less severe injuries to the brain, for instance, small surface hemorrhage or small parenchymal hemorrhage that don't need surgical intervention, follow-up imaging would be important to make sure that these lesions or injuries resolve. So typically the clinician will ask for a follow-up CT in 1 to 2 days, and sometimes again after a week.